and it stands for progressive and regressive, the R in rails, angular isometric loading, and that's basically just a fancy name for pushing and pulling without any change in muscle length or without any movement. So we're going to start in our 90-90 position, which you're familiar with, and if not, there's a video on that as well. I'll explain it. So we're going to be working on the front leg, which is external rotation for the front hip. So in your 90-90 position, you're going to be here with both legs at a 90-degree angle with heel, knee, heel in one straight line here. And I will change positions to show you a few different things. Couple important things to keep in mind as we go through this is one, this should not be painful. It's going to be uncomfortable because you're going to be here for a while. However, if you get any sharp shooting, pinching feelings, I want you to decrease the intensity at which you're stretching. So the most important thing is going to be closing ankle joint pain, which means that if you are moving toward a joint and you are getting pain or pinching in the same direction that you're moving towards, don't push into it. That means that tissue, something can be pinched in a joint and you could potentially damage it if you continue to push into it. So just like I've explained with the squat, right, as you're coming down into your squat, if you're getting pinching in the front of your hips as you close this joint angle, that means that something is being pinched in there. You don't want to push through that. That's not a stretch. That's not a beneficial feeling. It will generally just get worse. So pay close attention to that as you get into this position. So in the front here, we're going to work on this leg. This back leg you may feel some tension here. So if you start to get pinching in the front of your hip or on the outside here, I'm going to have you bend your leg in further and that will take tension off of there. We're going to get to this one, but as of now, I don't care what's happening with this one as long as you're not getting pain in it, okay? So you have your 90 degrees here and here between the hips, and you're going to sit up nice and tall. So you want to maintain this nice long spine throughout the entirety of this exercise. The goal is to isolate this hip for your movement as opposed to rounding into the spine and kind of compensating for your lack of hip movement, right? Which is exactly what that is. When you run out of room to lean forward here and you start to do this, right, that just means that you're stretching your back, which is fine. That's just not the goal right now, okay? So starting here, what I want you to do is I'm going to have you lean away, and I want you to lift your foot, keeping your knee pinned down on the ground as high as you can here, which mine is not very high right now, right? I'm staying nice and tall. I'm just leaning completely away from that foot and that ankle. And what you see here, so knee stays on the ground and you're lifting your foot, okay? Now, I want you to start to sit up until you can't keep this foot off the floor anymore. And then you're going to stop, okay? As you do that, you're rotating your pelvis back. You're kind of feeling like you're sticking your butt out. And this is where we're going to start. So the initial part of this exercise is going to be a 2-minute passive stretch. So I'm going to set a timer. I'm not going to completely count this down for you. We're going to do it generally. So you can use a timer or you can use your breath. So I want you to focus on your breathing here. I want you to focus on your posture. I want you to make sure that everything's in line. You're not sinking into that hip. You're nice and tall, chest is up. And you're taking some nice, easy, deep breaths. 4 seconds in through your nose, 8 seconds out through your mouth. Okay, we're just gonna find a super slight stretch here. Make sure you're not pinching on the inside of this hip. This hip can just be relaxed with that leg, sitting up nice and tall. So, we're not gonna do anything yet. I'm gonna talk and instruct you through the next part. While we get there, right now we're just relaxing. You might feel a little bit of a stretch, but it's not gonna be super intense right now, and that's okay. I just want you to come just to where that foot cannot be held off the ground anymore, okay? So, the next part of this that we're gonna do, don't do it yet, I will tell you when, but you're going to start to push the ground away from you. You're going to do this incrementally, so you're gonna start 1 pound at a time. You're gonna start at the knee. That's gonna take some pressure off of the knee joint, and you're going to start pushing down into the floor 1 pound at a time, not yet. 2 pounds, you're gonna move down to the ankle, so your whole shin is pushing down away from you. 3 pounds, your whole leg is gonna start to drive the floor away. There's no movement, you haven't moved an inch. You're just trying to get the floor away from you. Your body is staying stationary. 3 pounds, 4, slowly ramp up, right? You're gonna work up to about 70, 80%, and I'll again walk you through that once we get to it. Don't do anything yet, you're just stretching. However, if you feel like you can push harder, go for it, okay? Once you get to your intensity, whether that's 100% or 80%, we're gonna hold for about 10 to 15 seconds. The less intensity you put into this, the longer you're going to hold for. If you ramp up to 100%, you're not gonna be able to hold for 15 seconds, not if it's a true 100%. So that might be a lesser time of contraction. However, we're gonna do about 10 seconds here just for time's sake. And as you push, you're going to feel like your whole leg is driving down. Then you're gonna slowly relax, and then you're gonna try again to lift your foot up off the floor. It may not go anywhere at this point, and that's okay. I want you to just try and do it. You're not moving anything other than trying to get this foot up off the floor, okay? Not yet. Okay, so we're gonna slowly start to push down now. So I'm gonna have you start to push the floor away from you, start at your knee. You're gonna drive down 1 pound. 2 pounds, your ankle starts to drive down, so your whole shin is driving down. 3 pounds, you're driving down. 4 pounds. 5, your whole leg is engaged. You start to feel this in the back of your hip. You're up tall. 7 pounds. 8 pounds. 9, 10. Say we're at 100%. Okay, this might be 80 to 90. You can vary it. Go until you're comfortable. You feel the contraction, but you're not dying, right? I want you to breathe. We're gonna hold this for 10 seconds. We've got about 3 more seconds. 1 more deep breath. And now you're gonna slowly relax the leg, and you're gonna try and pull that foot up off the floor. Notice my body is not moving. Nothing is moving except for maybe this foot trying to peel up, right? You're not leaning away so that you actually get some movement, but you should feel all of the inside of this leg working, working, working. We're gonna hold here for 10 seconds. We're at 5, keep going. Pull that leg up off the floor. 2. Now I want you to lean forward ever so slightly toward that leg so that if you got it up off the floor, it's now taking away that space. Okay, you're gonna come into the stretch just a little bit further. Take a nice deep breath, relax the leg. Breathe, make sure you're not getting any pinching in the front of your hip. I'm getting a little bit. If you get pinching here, one thing that can help is either turning to the outside or turning slightly towards that foot. Take your belly button that way, don't just twist your chest. So your whole pelvis is rotating here. And you don't have to, but I'm getting a little bit of pinching here, so I'm gonna adjust. Again, I'm up nice and tall, nice long spine. And now we're back to relaxing. We're gonna do another 2 minutes. We're gonna do 1 more round on this leg, and then we're gonna switch sides, okay? So, we have another 2 minutes here. I'm gonna continue to talk. So, when you are doing this, again, this is scaling it to your ability. So if you get uncomfortable here, you can come out of it a little bit. Try to maintain as much tension as you comfortably can, because that's the point of it, right? The goal here is ultimately to increase your range of active motion or active strength. So a lot of times when somebody is really flexible, they can push themselves into the splits, right? But they couldn't do a standing split by just standing and and raising their leg up, right? Most people can't do that. You have to force your leg into that. So the forcing of your leg into that's called passive flexibility, which means you're not doing anything, right? You're passively letting your leg and your body do it at once. That's great, and you need that component in order to gain mobility. However, mobility means that you have the capacity and the strength to move your own body into those ranges. So that means that if you have full mobility and range of motion, that you could be standing and pull your own leg up into a split. Okay, so that is the goal of what we're going for. We are working on rotation, which is the first component of any joint movement when it comes to the hip as well as the shoulder, right? These are both ball and socket joints. And so if you don't have rotation first, you're going to be hard pressed to gain range of motion in any other direction. So we're starting with this because I feel like this is what most people struggle with. So that was about 2 minutes, and you're still breathing. Now we're going to start to push again, okay? If you start to feel this in your back, I want you to come out of it slightly, and I want you to focus a little more on that hip and pelvis rotation. And you may feel that there's slight solely because you're extending to there, and that's okay. A little bit of tension is fine as long as it's not pinching, okay? If you find that after you do this, it's hurting, or you find yourself a little bit too sore, then back off then. Okay, so we're gonna start to push, you're gonna start to drive that knee down into the floor. 1 pound, you're pushing the floor away from you, nothing else moves. 2 pounds, move down to the ankle. Whole shin is driving down. 3 pounds, whole leg is driving down. You're feeling that to your glute, you're warming up. Punch your hand down into the floor. If you wanna get super intense with it, you can punch this arm out. You're driving down 5 pounds. 6, still breathing. 7, 8, 9, core is tight, spine is long. 10, and hold. We're gonna hold 10 seconds. 9, keep breathing. Okay, you're driving that leg down, nothing else is moving. Core is strong, arm is braced. 3, 2, 1, slowly relax the leg. Now you're gonna pull that foot up off the floor. Don't move anything else. Nothing else is moved. You're working the inside of this leg. You feel that? Trying to pull up, pull up, pull up, pull your knee to your chest, foot to your head, whatever you have to do. Stay tall, stay long. Don't be collapsing here. Chest up. 3, 2, 1. Now, before you let that foot go, I want you to come towards it just ever so slightly. Take away any space that you created if you did, and if not, see if you can just sink a little bit deeper into that stretch, okay? Take a deep breath, completely relaxed. All right. Now, we're gonna do what's called some passive range holds. So, you have come into your stretch, right? You are deep into the stretch. Ideally, that was 2 rounds. You're going to work up to doing 1 more round. I'm only gonna go through 2 because that's what I want you to start with. You can rewind it if you wanna follow along, or you can do your own sequence. So 2 minutes of stretch, 10 to 15 second push in, 10 second pull deeper into your stretch, okay? So, what we're gonna do from here, this one I'm gonna have you create tension. You're going to post your hand up into the floor. You're going to punch this hand out. Now, you're going to try and pull your leg up off the floor, just like we did with the last part of our stretch. You're gonna pull that up off the floor, pull out of the floor, hold it there. Now, you're going to lean away, and you're going to bring that foot up with you. As far as you have to lean away to get that foot up, hold. 3, 2, 1. Relax, sit up tall. Come back into your stretch. Breathe. Okay, we're gonna do it again. Punch into the floor here, punch out. Pull that foot up off the floor. Get it up off the floor, get it up off the floor. Slowly lean away, pull it up, pull it up. As soon as it gets off the floor, you're gonna hold. 3, 2, 1. Good, come back into it, sit up tall. Find your stretch, no pinching in the front. Start to work in here though, right? Sit up tall, take a breath, brace. Pull that foot up off the floor. Don't move yet, just pull it up, pull it up. Now lean away, bring it with you, Leave the knee down, foot comes up, hold. 3, 2, 1. And now, slowly, straighten that leg out. Ooh, that's good. Okay, you are going to switch sides. You can rewind that, follow those instructions for the other side, and ideally finish out with some hip cars.